My name is Claudia de la Cruz. I am a dermatologist based in Santiago, Chile. I am the director of Clínica Dermatologist, and I am also the secretary of the International Psoriasis Council. Since my early career, I was in touch with psoriasis patients, and I was really very motivated to help them because in my country, Chile, we saw that there were a lot of patients that were with moderate or severe form of psoriasis that couldn't have access to treatment or couldn't be properly treated at that point 20 years ago. So it was really challenging for me to work with psoriasis patients. In my university career, I worked for the Catholic University for 13 years. I was focused on psoriasis patients, on phototherapy. And then in 2010, I founded Clínica Dermatologist, which is an outpatient clinic where we have been doing clinical trials for psoriasis. We have been doing a lot of work for psoriasis patients with my team. And at this point, I would like really to thank my team, because if it wasn't for all of them, none of this could have been possible. In 2019, we started with the idea of creating a campaign for psoriasis patients, an online campaign, and that has been something that has been really stimulating us as a team to work for. In 2020, we launched the campaign Treating la Psoriasis, Tratando la Psoriasis, which has been really very challenging for all of us. We have been trying to give advice to our patients to all over the country, from the north to the south, telling them about the disease. In Chile, it's very difficult the access to dermatologists and to specialists in psoriasis. So we have been trying through this campaign to get in contact with our patients and to have the patient perspective, which is, I think it's really very important, especially nowadays. So recently we have been awarded with an international prize, Aiken Prize for Communications. This has really been so special for us because it's been in a category named Sustainability in Health, which is programs that are dedicated to health education and to improve the patient quality of life and health. So for our team to have been awarded with this is just such an important recognition, and we are really looking forward to move on with this. I think that the IPC has really been one of the most important aspects in my life as a dermatologist dedicated to psoriasis. Why? It's because the impact of IPC has had not only for me in my career, in my personal career, but also through IPC, what we have been able to do to help our patients in Latin America. When I became a counselor with my friend Ricardo Romiti, we created the Latin American Working Group, which reunited dermatologists leader in psoriasis in all Latin America. And we have been very active writing position papers, helping dermatologists from all over Latin America to improve their education, master classes. There has been a lot that we have done through this group, and this has been really important for the region. So that has been a huge impact in Latin America for IPC. And on the other hand, since I became a secretary of the IPC, I think it's been wonderful working more globally. It's been wonderful to see how regions of the world that have been underrepresented, now we have been very active trying to promote the education of psoriasis to dermatologists and health professionals of those areas to improve their diagnostic, to know more about psoriasis, help them find education and programs where they can improve their career. For example, fellows from all over the world have been able to improve their careers in psoriasis. And we are really proud about that because all our previous fellows or our former fellows are wonderful leaders in the regions right now. Since 2018, we've had this program and it's been very rewarding. I think IPC has really changed the way dermatologists around the world see psoriasis, treat psoriasis. There's a huge work to be done. And so next year, which is going to be the 20th anniversary of IPC, I think it'll be marking the next 20 years to reach more countries, to reach more dermatologists, and to be a wider organization. And it's been really crucial. We have now members of the board from almost all the regions of the world, but we're really looking forward to grow bigger.